This president has asked us to pass SHA. We sat here until 10 p.m. Pass it for him. What have you done for him?
SHA kicked off on 1st October 2024 after the Social Health Insurance Act was rushed through Parliament in November 2023. It's supposed to be Kenya's big swing at universal health coverage, replacing the NHIF and tossing in initiatives like Taifa Care to make healthcare more accessible. Sounds noble, but the thing is, it's mandatory. Every Kenyan has to sign up, no choice, no debate. 2.75% of your gross salary is slashed if you're formally employed. There are flat rates for informal workers with some subsidies for the poorest. But there's simply no opting out. By May 2025, SHA had dropped in over 22 million Kenyans. The NHIF, born in 1966, though voluntary, was a mess in its own right, focused on inpatient care, skimping on outpatient services, and bleeding money with 40 billion shillings in losses by the very end of the program. It was like a leaky bucket riddled with fraud and inefficiencies. SHA claims to fix that with broader benefits, think preventive care, outpatient services, maternity, emergencies, and chronic illness support like cancer treatment. By mid-2025, 5.75 million people got treatment, with 4.5 million accessing basic care and 2.2 million getting advanced services. They've also processed 45 billion shillings in claims, serving over 1.2 million people. But let's not pop the champagne. SHA's scale looks impressive, but forcing everyone into a system without proper public input is a red flag. The Social Health Insurance Act was rammed through with barely any meaningful public participation. Just a quick show of hands, not the robust debate you'd expect for something this massive. Compare that to the NHIF, which for all its faults at least let you choose whether or not to join. SHA's digital tools and mandatory contributions were sold as game changers, but early reviews show that it's less efficient than the NHIF in some capacity. And of course, fraud is still a problem. It's like they swapped one flawed system for another, slapped a shiny label on it, and told us to trust them. Yeah, so guys, if you've made it this far into the video, you can like, share, and subscribe to this channel. You can also support us on the M-Pesa till below. Your donations will enable us to continue bringing this kind of content to your screen. Thank you. Now let's get into the real mess. SHA's rollout has been a masterclass on how to fumble a good idea. People are fed up, and for good reason. Why the skepticism? Well, 75% of users point to corruption and mismanagement as the top issue. We are talking delayed hospital reimbursements, funds vanishing, and outright fraud. The latest outrage stems from Health CS Aden Duale's decision to suspend overseas medical treatment approvals for 30 days. This is a gut punch to the most vulnerable people who need organ transplants, advanced cancer treatments, or rare surgeries that Kenya can't handle. The law promises up to 500,000 shillings per person per year for these treatments. Duale's freeze, meant to streamline things and curb fraud, has left patients stranded. Some are already abroad in India, Turkey, and South Africa, stuck in hospital wards or guest houses, unsure if their treatment is funded. Others at home are watching their conditions worsen while SHA figures out its approval hospital list due in 30 days. Who poses life-saving care just like that? It's callous, and the lack of a contingency plan screams incompetence. Advocacy groups are livid, calling it reckless to halt a lifeline without a backup. Now, sure, corruption in overseas referrals needs fixing. The NHIF was notorious for it, but this blanket suspension feels like punishing the sick to fix a broken system. The problems don't end there. SHA's shutting down all its sub-county and regional offices, including 7 in Nairobi, leaving just the Upper Hill branch open. CEO Mercy Mwangangi claims it's about cutting costs and going digital, but closing offices in a country where digital access isn't universal is a disconnect, and it reeks of prioritizing budgets over people. The mandatory nature of SHA rammed through without real public input is bad enough. If you add in the corruption and the mishandling of patients needing overseas care, it's hard to see this as anything but a poorly planned power grab, dressed up as reform. SHA's got big numbers, but it's failing on trust, fairness, and execution. What do you think? Can SHA pull itself together, or is this just another government scheme leaving Kenyans high and dry? Let me know in the comments.